My dear friends, it's Friday again. And remember that this week, as every week, at 7 p.m. Eastern Standard Time, you can tune Truth Be Told Radio Network. We're going to be talking about you. We're talking about the people that you love, because we're talking about health. And we're talking about recovery and healing. So please follow us. If you miss it, go back following Saturday, 9:30 Eastern Standard Time. But it gets better, because you can go to Spotify and search for Truth Be Told Radio Network. Also, make sure that you follow us in the social platform, the social media of your choice. We are in just about all of them. I cannot mention because I lost count of how many, but the social media of your choice were going to be available. And I'm ready to answer questions, and I'm ready to listen to your comments. Please feel free to contact me. Feel free to call, to click. We're going to be there for you. My dear friends, we're talking again, we're meeting again, and I hope that you're following me. I hope you're listening to many of these broadcasts, or that you're reading the blog about all these subjects, all the health issues that we discuss each and every time with you. Because I feel that one of the quests of my life, one of the things that I love to see, is less and less people with chronic degenerative disease. These are diseases that are very costly economically, and also from the human point of view. There's a lot of suffering, a lot of sacrifice, a lot of problems for those that have the disease, but also for caretakers. And anyone that has had a chronic disease in the family or with a friend knows how difficult, how big a burden it is to help somebody to go through all these diseases. And what breaks my heart, it really breaks my heart, is to know that most of these diseases are either avoidable or could have been diagnosed a lot earlier. And you probably know it. We all know it. I'm not telling you something that is unbelievable. I'm telling you something that's an absolute truth. The earlier you have a diagnosis, the faster you're going to get on a treatment. And the treatment is going to be easier, more effective, less costly, and with a lot of less suffering. I'm a doctor, and I see patients all the time. And I go to the hospital every day, still to this day. I have over 50 years as a physician. And let me tell you that in a conversation with the patient yesterday, we found cancer in the lymphatic nodes. This is called a lymphoma. Probably as a consequence of a long haul COVID. After the COVID and all the symptoms of what we call long haul COVID, this person continued to feel bad and sick and so on. And after a year or so, we started thinking that there might be something else. And then we found a lymphoma. And we found a lymphoma because it was in a place where it was painful. So one thing brought us to the next. The patient had a constant painful complaint in one part of his body. And of course, you go and search that part of the body. That's what you're looking for. And sure enough, you get a positive diagnosis. And I was talking to this patient yesterday, and the patient says, "Doctor, if this thing had been painless, what would have happened?" Well, you know, what probably would have happened is that we would have taken a lot longer to get a diagnosis. Number one, because you would not have come to us looking for help. And second, because the pain guided us to a certain anatomical area. That was the problem. So, in a way, many times a symptom, a pain, a discomfort, anything that happens in your body is a blessing. It's a blessing that is telling you, hey, you have a problem here. You have to look for medical help. The next problem we have is that many times we disregard symptoms. We don't pay enough attention, and it's not in our screen, our radar screen. We don't have it in front of us. We're not thinking of, it could be me. I could have a problem. And today, we're going to talk about something that illustrates very well the situation. I'm going to talk about breast cancer. Why breast cancer? We have talked about it before. Do we have to insist in talking about breast cancer? Yes, we have. And we have because there are many situations about breast cancer that can be a real blessing if only we pay attention. It's that simple. We need surveillance. We need to be vigilant. We want to be aware, but we have to be aware of what? We have to have more information about what we should be looking for. Cancer, in many ways, has the problem of being painless. Very few cancers are really painful. So that's not the reason you're going to go and see the doctor. Many times they're very insidious. They grow and grow and grow without even you getting notice of them. A lot of cancers are first diagnosed because of metastasis, because of distant tumors. The tumor already did some damage here, and now it's sending colonies to different parts of the body. And we find out that that person has cancer because we found it in the bone, because we found it in the liver, and then we say, oh my God, this is a cancer. Where is it coming from? You see, and then we have to walk in reverse in your anatomy, in your physiology, to find out where that cancer began. Had it been painful the first time, we'd probably have done as the person I'm telling you about. We go to that site, we search in that site, and sure enough, we can find the diagnosis. Breast cancer, unfortunately, has a lot of those characteristics. You can have a breast cancer sometimes for years without you being aware of what you're carrying. So what we have to do with breast cancer? Well, we have to be very vigilant. We have to be very, very vigilant. And let me insist on it. Let me insist on it because, number one, breast cancer is the number one female malignancy in the world. And second, is the most deadly cancer in women in the world. And certainly, America is not only an exception, but breast cancer is very prevalent among the people that live in America. So, there are a lot of things to talk about here. There are a lot of things to discuss in terms of why me, I would say why us, why America. And we have to start questioning a lot of these things, but we're going to talk about that further in this conversation because that's going to lead us to prevention. But right now, my dear urgency is to insist in early detection, because that's something that's within your hands, literally. It's literally within the hands. It's at the tip of your fingers. We have to know about breast cancer. We have to understand that it's important to detect it. We have to absolutely comprehend that the earlier we start, the better results we're going to get. So I have to be searching for it. I have to be on the constant watch and surveillance. So I'm going to use, first of all, the tip of my fingers. I'm going to review myself. And there's a routine. You can find many ways to do it. You raise your arm, laying down, and you pass your fingers over your breast and your axilla, and then you do it the other way. etc. And you say, but what am I looking for? The first thing you're looking for is you're looking for how it feels. And the more you do it, the more you're going to get a mental map of your breast and your axilla on both sides. And now you know how it feels. Now you know what's in there. Now you know how soft, how supple, how everything is going to be. And then with that first lesson, now you can be on the watch. You're going to look for things shouldn't be there, for things that were not there last time you checked it. So you don't have to do it every day, but you can surely do it every week. It costs you nothing. You take a shower, you lay down, you can be watching the news, you could be having some relaxing time, and at the same time examining yourself. By that, we might be able to detect things that shouldn't be there. And you say, well, I feel something, a little thing here. Now, a nonchalant attitude is the worst you can do. You have to say, oh, this might be this. Yeah, you can get a mental explanation, but my advice is then look for a second opinion. It's time to talk to your doctor. And he will help you with a second examination, and he might help you with a little bit of imaging device, like ultrasound or even a mammogram, whatever is in his and your head, and you can agree on. That's going to give you a full spectrum of things, and all of them are important, because then you're going to have control in your hands. My advice is that you do this routinely. You can check your breast yourself every week, but you have to do a very good review and go to your doctor at least once a year. And to keep track of it, you can do it your birthday. You can do it in the springtime. You can do it in Easter. Choose whatever week of the year you want and do it regularly, once a year. And your chances of detecting this malignancy very early are going to increase tremendously. And your chances to absolutely beat the disease are going to be also to great, fantastic numbers. And that's what I want. Don't go anywhere. We have to keep on talking about this. We've been talking about how to detect very early breast cancer and how important that is. And what I'm telling you is to give it all the importance, all the priority in your life it deserves, because it can save your life. It can change your life for better in a huge way. I cannot even begin to tell you. I work in a hospital. I have seen cancer patients all my life. And believe me, when you detect a tumor very early, it's many times easy, many times very painless, many times, etc. But the most important thing is going to be an effective treatment that's going to give you much better survival, much better well-being than just get to it when the tumor has expanded and has produced a lot of damage in your body. So that is the importance of my message. And some people say, but doctor, I do my self-examination every so often, I don't find anything, etc. Okay, that's fantastic. But at least once a year you need a professional opinion. So at least once a year, plan a visit with your doctor. Talk to him and say, doctor, I've been doing the same thing. I've been doing this, I find nothing, etc., etc. What else you think I should do. And the doctor is going to examine you. He examines people all the time. And many of those people that he examines have breast cancer or breast problems. So for him, his ability to detect and to tell what's happening is going to be different than yours. It's going to be a different perspective. So we use that expertise also. Not only your surveillance, but we're going to use his expertise to make sure that what I'm looking at, what I'm feeling, what I'm finding is exactly what's happening. So the expert fingers of the doctor are going to be my second line of defense. And then it is you and your doctor who are going to decide what else you have to do. And there are many things. The imaging medical world has a lot of options. You can do an ultrasound scan, you can do a mammogram, you can do a tomography, you can do magnetic resonance. All of them can be helpful. But it depends of what you're trying to feel or what you're trying to rule out, what is going to be the best tool. And I'm not saying you do it or you don't do it. I'm saying you sit with your doctor and then you start making your plans. And you can ask him questions. I ask you to ask questions. I ask you to tell your doctor, doctor, what if this, what about that? We all have concerns when we come to this type of condition. So those concerns will be gladly answered by your doctor. Also remember that if you contact me, I'm going to be very happy to answer your questions. So that is another line of defense. Doctor, I have felt this. What would you think I should do next? But what I'm telling you is you do three things. You do self-examination, you visit your doctor, and you agree on any diagnostics that might follow. With that, you're going to be happy and satisfied and ready for a full new year. Just by doing it, you're going to be happy. This is very important because breast cancer is increasing. We're seeing more cancer than ever. But I was telling you in the beginning of this conversation that breast cancer has a different geographical presence around the world. There are countries where breast cancer is very prevalent, and there are places where you see very, very little breast cancer. So when that happens, and it happens with a lot of diseases, that happens with high blood pressure, that happens with heart disease, that happens with diabetes, okay? If you live in one country, you do not necessarily have the same statistics that if you live in a different part of the world. And every time that happens, I have to stop and think, either they are doing something good that we do not do, or we're doing something bad that they don't do. And that is the beginning of a chain of thought that's going to take me to very good answers. And unfortunately, and I say unfortunately because I love food, we have to understand that a lot of cancer, and breast cancer is not an exception, is connected to lifestyle. What are we doing with our lives? What are we doing with this body of ours? How are we carrying this body? Are we treating it well? Are we giving it the rest it needs? Are we giving it the exercise and physical activity it needs? Are we giving it the clean air and good water, sufficient amounts? Am I eating the things I should be eating? Or I'm pushing just for the pleasure of it, because we call it comfort food. I don't know why, but we call it like that. A lot of very pleasurable things that are filled with two main problems. One is refined sugar, and the other one is bad oils. To me, those are the main villains. When you go to other places of the world, let's say in France, everybody cooks with butter. When you go to Spain and Italy, it's olive oil. When you go to the Orient, they use very little. I mean, when they use the wok, they use some oil, and they just use it and use it briefly. And but when we come home, we see that we use a lot of vegetable oils, so-called vegetable oils, because they're not really vegetable oils. They come from seeds, from corn, from a lot of seeds that we use simply because they are less expensive. To me, that's the number one reason. The other one, because we have not developed a taste for it. When I tell many times people, why don't you cook with olive oil? Because they say, no, because it has a taste that the vegetable oil doesn't have. So what we have to do is we have to retrain ourselves, because it is important. If it were not important, I would not be telling you about it. But we eat a lot. We eat huge amount of calories. Most of them what we call empty calories. Refined sugar. Lately, fructose. Because we have a sweet tooth and we like sweet things. But food companies do not like to spend money in sugar. So now they feed us high fructose syrup, which is very inexpensive, but it is a substance that our bodies are not used to metabolize, particularly in the quantities that the soda pop and food industry is giving us. So what happens is a lot of that is going to end up in the liver. And if you search for other programs like this, you're going to find one on fatty liver, a very common condition that we're seeing today. Bodies that don't know what to do with those calories and send them to the liver and create fat deposits in the liver. And you go to the doctor and the doctor says, oh, you have fatty liver. But they never tell you it's because of your lifestyle. So we have to read about it, because that's the main difference why our people are so affected by breast cancer, and I might say other degenerative diseases like high blood pressure or heart disease or diabetes, because our lifestyles. It is about time. It is about time that we sit down with the whole family and review what we're doing with our lives, particularly because if I have children, if I have grandchildren, I want them to be as good as they can. So I'm going to train them, I'm going to teach them to like good foods. I'm going to show them to eat less. I'm going to give you a simple example. You might have a picture of the Last Supper at home. Go and take a look. Look at the proportion between the bodies and the size of the plates. They were eating in plates that today we would call salad plate. A lot smaller. But today we eat a huge amount of food. Actually, many times I have heard people that categorize a restaurant by the size of the portions. They're not helping you. They're going against you. But remember that every step of the way, it is you, only you, who can make a healthy choice. I really want to thank you for being with me. And if you're coming from the different segments and you're still following me, thank you very much. Thank you very much, because I really appreciate it, and because you're helping yourself. Remember that all these broadcasts are about you and the people that you love. There's not one word that I don't mean to deliver so you can hear the message, so you can get the message. Because when you read the numbers, we can tell you that according to medical research worldwide, 70% of cancers are related to lifestyle. 70%! That's a lot more than just one half of the cancers. You know, it's been, I don't know, it's been probably 30, 40 years when I said in a conference that I was absolutely convinced that if people stop smoking and if people started eating right, cancer rate could drop by one half. And you know, I had so much criticism because, number one, I was connecting cancer to lifestyle. Second, because, well, some people accepted cigarette smoking, but what food had to do with cancer? And now it's not only food. Now we have to add physical activity, sunlight. And I was wrong. It wasn't half. It was 70% of cancers are related to lifestyle. So I was telling you, why don't I get my family together and say, hey, children, because we have to treat our children in many ways for what they are, smart, intelligent human beings. Hey, why don't we start making changes? In fact, I have seen families that are changing their ways because the children brought in the changes. I have friends that come and tell me, well, we're changing everything because my daughter decided to be a vegetarian. Not that I'm for vegetarianism, I'm not. And one day we can have a program to discuss why not, why yes. But I can tell you, anyone that chooses to make lifestyle changes has my blessing. Because it's showing me that that person already saw the problem that our regular lifestyle is bringing to our health. And finding no better answer, sometimes we choose an easy way, like, oh, I'm going to be vegetarian. You see? And when it happens, I say that person is beginning to think right. All that person needs a little bit of guidance, advice, information, education. And that's where I can help. I'm not telling you that I know all the answers, but I can tell you that if you contact me, if anybody in your family contacts me, if any child wants to contact me, I'm willing to talk on the phone. I'm willing to answer an email. I'm willing to answer WhatsApp. I'm willing to answer any message in social media that you have. I'm willing not only to answer the question, I'm willing to have a conversation. Because if I can help you make the right decisions, healthy choices, I'm on your side, 100%. And with breast cancer growing to staggering numbers on one hand, and with the other being present in younger and younger people, well, somebody has to do something. Because I watch the news, I watch everything, and nothing happens. It seems that it's not coming to anybody's head. We just say, well, my mother had breast cancer. Well, she has to go to the hospital. Well, she has to do this. Well, she has a lot of pain. Well, she's suffering a lot. But we never saw it coming. Why cancer and all these diseases that we're talking about are related to lifestyle? Because many people say, oh, it cannot be what I eat. It cannot be because I don't exercise. It cannot be because I smoke or drink a lot. I'm going to explain why. Because it's very easy to say, well, you're doing this wrong, you're going to pay it this way. I'm not that type of doctor. I'm the type of doctor that needs you to understand. Because the more you know, the more you understand, the easier it's going to for you to see the way out. What happens is that we were created in a way and given foods and a world to live in. Just read Genesis. And you're going to see that we were given the foods that we should be used for our nourishment. And if you read Leviticus, you're going to see that we were given, mandated, a lifestyle. Well, you go out of this world, and now to this world, and now you have the choice of doing a lot of things. And for better or for worse, in America, we have economic means, we have a lot of freedoms, and so on, and we use them many times against ourselves, because we do not understand that refined sugar, refined flours, bad oils produce a simple problem called chronic inflammation. Why? Because we eat them in such a huge amount that the body begins to see it as a threat. You can read studies that show that a toddler might be eating as much sugar as their body weight in 1 year. But even adults, we might be eating 50 pounds of sugar a day. If you only drink 1 soda pop a day, you're taking the equivalent of 50 pounds of sugar a year. So these are overwhelming amounts that the body doesn't know how to handle. And what it does is starts dealing with these substances as foreign, as a threat. So it creates an inflammation against them. Starts producing a low inflammatory response. To complicate things, many of the vegetable oils are not immune enhancers. It's pro-inflammatory. And this pro-inflammation also creates a problem. And once again, it's not because sugar in itself is bad, it's not because oil in itself is bad, because omega-6s are very important for the development and function of the immune system and the allergic reactions and inflammation, etc. They're very important, but we eat them in huge amounts. You know, the relationship between omega-6s, which are vegetable oils, and omega-3s, which are like fish oil, should be at least 2, 3, 4 to 1. Well, a typical American will eat probably 40 times as much that amount of olive oils. Because it's everything. It's in cookies, it's in fried food, it's in mayo, it's in artificial or commercial salad dressings, it's in margarine, it's in everything. We put it at the table every day. So all these substances together create an inflammatory environment. And that inflammation is going to grow and grow and grow and defeat a lot of the mechanisms that we have to detect cancer cells and destroy them, to induce abnormal cells to self-destroy through a very natural process. It's like in a city we're beginning to lose our police. We're beginning to lose a way to control abnormal population. What we're going to have is going to start developing disease. And that inflammation is going to bring about more inflammation. And you can see that as we grow older, typically we are less apt to do things. We have a lot of pains and aches. We have bloatedness. We have tiredness. We start losing everything. The problem is we're losing it younger and younger every time because of that chronic inflammation. And that's what we have to fight. And every time I move a muscle, I defeat inflammation. That's why moving and working and going on errands and doing things, climbing stairs, all that is so helpful. But also eating right and avoiding those foods. I invite you to open your Bible, read Genesis, read Leviticus. That's all you have. That's all you need. And you're going to find rules that are very important. And educate yourself. Learn more and more, because it's very important to learn more and more. Because if we can defeat inflammation, then we're going to conquer a lot of things. So if you say, okay, I'm going to start having a good salad. A good salad is not lettuce, by the way. Why not arugula? Arugula is not a lettuce. Arugula is a relative of broccoli and cauliflower. It's a cruciferous. So you can do arugula, you can do good vegetables, you can do all your veggies, you can do smaller amounts of meats. I'm not saying to avoid them, but smaller amounts of meats. Choose your oils. So olive oil, butter, real fats. Fats that were God produced, not factory made. So if we start making those changes, you're going to see that all of a sudden you feel better. And you start walking around the block, or vacuum cleaning your house every day, or doing things that are going to put you in physical activity, and you're going to see how a lot of your pains and aches start to melt away. All you need to do is a little bit of constance and obedience. I'll be right back with you. I have been talking about breast cancer, and I want to underline some areas of breast cancer. One, how important it is to have an early diagnosis. How important it is to know as early as possible that there is a problem. And I have discussed about not doing this, not doing that, not doing the other. Do it all. You're never going to exaggerate. You're never going to do too much. You have to do it all. Self-examination, routinely, once a week, once a month at the most. And visit your doctor when you find or when you have any idea that something might be different. But visit your doctor no matter what, at least once a year. And in agreement with him, plan to do whatever test he feels should be part of that examination. Because with all that together, you might be able to tell a malignant tumor very, very early. And that will get you on a very easy path to full recovery. If you fail to do all that, then you might get, as many people unfortunately do, you might find out you have a cancer when the cancer is far advanced. Remember, it doesn't hurt. It's not going to tell you any symptoms. It's not going to tell you I'm here. We have to keep on looking for it. Keep on looking for it. Surveillance, vigilance, awareness. I'm short of words to try to convince you how important this is. Because I've seen people that find out too late, and it's very difficult, and it hurts a lot in many ways. The second, we're talking about prevention. We want to make sure that we can prevent it, because now we know that about 70% of the cancers are preventable, because a lot of those cancers are related to lifestyle and food. So add to that physical exercise. So you have 3 areas of concern. We have to do all that, because if we do all that, then we're going to begin not only better, but we're going to be healthier, and we're going to be better performing. We're going to have optimum health. That's something that should be in our minds today, because let's face it, we have a lot of blessings. We live in a wonderful land. We live with people that we love. We have a job, we have a family, and with all the things that you can tell me about it, I'm still think that we have a lot of blessings in our life. So we want to continue our life. We want to live longer, but we want to be healthy. We want to enjoy the people around us. And then there is the third part. I have cancer. I have breast cancer. What am I going to do? Well, a long time ago, a very good friend of mine wrote a book that was called Now That I Have Cancer. And I have always reflected on that phrase. Because yes, it might be one day that you go to the doctor and the doctor tells you, you have cancer. And we have to say, okay, now what? The first piece of advice is relax, because stress it can only help cancer. So I know it's easier said than done, but trust God and say, okay, I'm going to start thinking of a good strategy. And in 50 years as a doctor, particularly in the field of alternative medicine, I've always encountered people that were doing different types of programs. Max Gerson, with a very strict vegetarian diet and coffee enemas and a very controlled lifestyle, but was successful. Had many successful cases. I saw Kerry Reams that was working on the acid level of the body. And to control the acidity of the body, and get this very clear, is not if you drink an alkaline substance. It is if your metabolic system is going to the alkaline side. And that can only be achieved by eating vegetables and very little meat and very little fat. So he was also very successful, because in trying to change that pH, that acid level, he was making a lot of good to the body. And I could mention a lot of things, and a lot of people like that. Dr. Kelly, with the use of enzymes. The German alternative school, the old German anti-cancer school, using a lot of proteolytic enzymes and so on. But all of them, when I start to put them back together, when I start to analyze them all together, all of them had a very important anti-inflammatory foundation. Enzymes are anti-inflammatory. Eating vegetables is anti-inflammatory. Coffee enemas are anti-inflammatory. Reducing the amounts of food that we eat and being more frugal about food is anti-inflammatory. So those people that were doing well and that orthodox cancer centers would call anecdotal had a real substance to them. They all were on a very anti-inflammatory strategy. So what I have done through years is put it all together and say, this is the first thing I want to do with you if you have a cancer. If you come to the hospital, if you come to BioCare Hospital, if you are my patient, that's the first thing that I'm going to do. I'm going to create an anti-inflammatory environment with food, with water, with enzymes, with enemas, with replacement and fixing the intestinal flora, with replanning the way our whole body works. Because if I can do that, I know your own body is going to do a lot of the rest of the work. Our body is not a test tube where you put things or take things, that's it. No. We have live bodies. And our live bodies can start working better when they're given the means and the ways. So by taking away toxins, by taking away inflammation, by taking away substances the body doesn't need, like artificial coloring or flavoring or chemicals, our body starts to function back again. It's like if you take a wilted plant and put it in the right sun and shade. It's like if that wilted plant, you start checking the watering, checking everything, and all of a sudden you see that starts to have little sprouts and then blooms. And that's what I have seen for many years at BioCare Hospital. Hydration. You cannot believe how many patients have come to the hospital in bad shape simply because they are dehydrated. And as we start hydrating them and making sure that everything works well, they start coming back to life. And I have had countless cases of patients that tell me, doctor, I thought this was it, but I feel so much better today. And then you have a smile. I have always said I work for smiles. Every time a patient smiles to me, that's the best pay. That's the best thumbs up anybody can give me. That tells me, okay, we're going in the right direction. But remember that you have to work with all that environment, with all that environmental, inflammatory environment. Because if you don't do it, then you're going to fail. I have read papers published by University of California that show that when inflammatory markers are very high, not even chemotherapy works well. How can it? You know, we keep neglecting the capacity of our body. We're a body made in perfection. All we need to do is pave the way, help the body, provide the means. And the body can do what the body knows how to. A word that has almost been forgotten. Our bodies can heal. And that's what we're looking for. We're looking for healing. For our bodies coming back to life and start fixing this, fixing that, recovering that function and so forth. That will bring energy and recovery of cells and recovery of functions. So when you have cancer, yes, you have many options. And as I have told you repeatedly, you can call, you can send a message, you can connect with us. And we're going to be very happy to be with you and very happy to help you, because that's what we do, day in, day out. Till next program, I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital.